they can't get their toe rings off, you can put some lotion for them, and they kind of work its way out and it slides off. Some people are just not going to be able to get it off. If you can't get off rings or toe rings, make sure you document that in the techniques. Bringing this up waist height as you're talking to your patient. That way you're not bending over, okay, potentially hitting your head on the tube, like we discussed before. Pregnancy, ask them about that during the instructions. So, you know, just tell them during your dressing instructions, don't do the shield. The pregnancy questions, ask them which foot hurts, okay, so you know specifically which side you're doing. Because doctors, even though they're looking at their patients, they look at this one, sometimes they don't correlate that to their left side. Or the patient will say left when they think it's right. They'll put the wrong order. So don't assume that it's right. Ask them, where does it hurt? There's a lot of bones within the foot and ankle, so you want to make sure the right order is there. I'm just going to roll this up a little bit. Technique, foot, 55 and 4 for the AP and heel tape. So because we are doing tabletop on this one, we're going to position first before we do anything to our tube. So you scoot over a little bit to your left. Sit your foot flat down on there. So you want to put this directly in the middle of your foot. She has small feet, so it's easily fit on there. Some people that have longer feet, you might have to move it a little bit more, or you might have to go diagonally on some people's feet. Okay? If you clip off a little bit of this back portion here, or it's really close to the edge, that's fine, because with the AT angle on there, it's going to be all superimposed anyway, so you can clip a little bit of that off, which is fine. Any chance to be pregnant?
No.
So hold this in your lap. Marker where it's tapered down towards the outside. What's the angle on this?
15
degrees. 15 degrees, okay. It could be 10 to 15 degrees depending on how flat their feet are. If their feet are really flat, you probably don't need as much of an angle on there. So you want to kind of evaluate their feet as you're looking at them too. Okay, just get it close, okay, and then use your free-floating tabletop to move it around side to side and top to bottom. So start one way first, top and bottom, and then bring it in, squeeze it in side to side. You can do this either laying down or sitting up like she is now. Okay? Some older patients have a real hard time holding their leg back like this, so they start pushing this back so it starts traveling a little bit. As long as the knee is bent up, they can put their foot going down instead of across, it'll stay in place. Okay? You might need to put a little sandbag across there sometimes. It just depends on your patient what they can do. Okay, top to bottom, we got a little bit of light above the longest toe, okay, side to side. We've got first toe all the way to the fifth toe going all the way down. You see the heel is slightly clipped at the back. That's fine. Okay, we're just trying to get a little bit of the malleoli on both sides to have a decent angle. Okay. So just like hold still, don't move. Rotor, exposure. Questions on this one?